All right, good afternoon or good evening, everyone. I'm so delighted to see so many of you all have joined the webinar this evening. My name is Ralph Belk. I am the co-chair of MARFY, the Maryland Association of Resources for Families and Youth. And I have the pleasure to be joined by my colleagues in partnership with the University of Maryland School of Social Work and the Maryland Resource Parent Association. And tonight we have the pleasure of sharing the outcomes of a survey that we did with foster parents across the state of Maryland. This came out of the work that MARFY has been doing over the last couple of years around policy, public policy, and advancing initiatives that support youth and families and providers, actually, that serve youth and families across the state of Maryland. And so we have a Tuesday public policy group. And in that group, we formed subgroup work groups, and foster care rose and came out as one of our 4 sub-work groups. And so as we looked at and talked about what's important to be able to support foster parents, we realized it was important to hear directly from foster parents. We can't make assumptions of what it's needed. And so we created this work group, and we invited some foster parents to join us and did some consultations with them. And then we partnered with the Maryland Association for Resource Parents and got their consultation and developed this survey. We then tested with a few of our foster parents that were part of the work group and got additional feedback. And so we released the survey twice, and we're pleased to have over 200 respondents to the survey. The first round was last year around March, April, in the spring, and then we did a second release during late summer in August. And so over with the 2 releases of the survey, over 200 families responded. And so if any of you on the call were one of those respondees, we thank you. And also, though, we thank everyone who's a foster parent, a resource parent, adoptive parent that's on this webinar tonight. We thank you for your service. We thank you for what you have done and are doing for youth across the state of Maryland. We couldn't do foster care without you. So thank you for your partnership with the state or the county that you're working with, or the partnership with the provider that you are working with. So again, thank you, thank you, thank you. And again, now pleased to kind of share our learnings, and really the goal of this, I didn't say it already, the goal of this is really to inform our advocacy agenda. We're advocating with our department leadership, we're advocating with legislators across the state, and so we want to make sure that we were accurate in our advocacy, which is why we sought out the feedback from our foster parents. So I'll pass it over to Andrea, and she can introduce herself, and then she can take us to the next step. Andrea?
Yeah, I'm Andrea Widener. I was working as part of the group. I wanted to tell you a little bit about how we designed the survey in the first place. We basically solicited questions from foster parents on Facebook in different Facebook groups, and then talked to foster parents trying to get our sort of an examples of what we should ask. And then, so that was our foundation for the survey. So foster parents were the foundation from the beginning. And I think that's about it. So Kim, I think it goes on to you.
Yes, I will take over. Thank you, Andrea. So just to start with the survey sample, so the folks that responded to the survey, as Ralph said, we did get over 200 responses. There were 205, and they were mostly currently licensed foster parents. So we had 92% currently licensed. We had representation from 16 of the local jurisdictions across the state. That represented 82% who were licensed through public child welfare. And then we did have 18% who were licensed through private agencies. And across those folks, we had 9 different agencies represented. 60% were fostering as a couple compared to 40% who were single foster parents. The length of fostering ranged anywhere from less than a year all the way up to 21 years or more. But the majority of foster parents had been fostering for 4 years or less. And foster parents fostered between 1 and over 40 children, but most had fostered between 1 and 5 children, and the average length of a participant's longest placement was 2.7 years. So that's just kind of a brief snapshot of the foster parents who responded to the survey, and then we'll get into some of our findings that covered a bunch of different topic areas. So the first topic area that we're going to cover is about the reimbursement rate. So respondents of this survey were pretty split on whether they felt that the subsidy covers the expenses of caring for their foster child. So 52% said yes, it did cover their expenses, and 48% said no, it didn't. Foster parents who reported that the subsidy reimbursement rate was not sufficient said that they spent anywhere from $50 to $2,000 more than what they were given for their subsidy each month. But the majority of foster parents reported spending between $200 to $500 more per month. And we also collected, participants were able to write in some of the things that they often spent money on outside of the subsidy rate. So these are just some of those things that participants noted. So clothing, activities, childcare, specifically daycare, summer camp, and respite, personal care supplies, vacations, and leisure entertainment activities. Quite a few folks mentioned costs associated with school, so paying for picture day, field trips, yearbooks for kids, and things like that. And then just also increased housing related costs. So having to purchase new furniture, having to make home repairs, and the added expenses for utilities were also noted. The next set of findings are all related to court. So of the participants who responded to the survey, 21% reported that they were not notified of court hearings. 29% reported that they were not notified consistently. And then 50% reported that they were notified of court hearings. And most participants shared that they received that notification verbally from their agency, but there were a couple other methods. So some folks said that they got it in writing from their agency or from email or via text message. Quite a few mentioned being told by the child's attorney or the CASA. And then of those participants who typically go to court, they also reported that they learned of the next court date while they were in court. 76% of the foster parents who responded reported attending court hearings. And almost a quarter reported that they had been asked to leave the courtroom. So reasons that they mentioned for being asked to leave the courtroom were typically for the privacy or confidentiality of the biological parents. And they stated that the request was often made by the attorney of the parents. And in some instances, resource parents shared that they were not told the reason that they were being asked to leave the courtroom. 54% of the foster parents who responded reported that they were not informed of their right to speak in court. And when asked about their experiences speaking in court, it was pretty mixed. Some folks shared that it depended on the judge or maybe the local department that they were working in at the time, whether they were being asked to share in court, and some just were never asked, and then some reported being asked pretty consistently. In relation to CASAs, or court-appointed special advocates, 57% of foster parents reported that their foster child had been assigned a CASA. And some of the reasons that foster parents shared that the CASA is helpful was that they're a good resource. They're another trusted adult that the foster child can talk with. Sometimes they are the only consistent member of the child's team. So if the DSS worker and other folks are kind of constantly changing, maybe the CASA is able to be someone who's pretty consistent. And foster parents also shared that the time the child spends with the CASA allows them to get other things done during that time. When participants shared that CASAs were not helpful, it was typically shared that they don't testify or show up in court. They stated that it's just another person that they have to try to schedule meetings with, in addition to all the other members of the team. And some noted that the CASA workers are not seen frequently enough to build meaningful relationships with the children. Stephanie, I don't know if you wanted to remind people to.
Sorry, if you're just joining, real quick, if you can just put in the chat your name and the county you're from so we can make sure to award your training certificate. Thank you.
Okay, so switching gears a little bit to the foster parent relationship with the worker. So 77% of foster parents said that they feel that their foster child's current worker is listening to their concerns about behavior and other issues. However, 42% reported that they had trouble with non-communicative social workers. And this is just a quote from one of the participants that we felt like really highlighted this. So they said, the consequences on lack of communication fall on the child and resource parent. Unfortunately, we are often left scrambling to make sense of things and fix problematic areas solo. And so some of the consequences of lack of communication with workers that were cited by participants were foster parent turnover, unnecessary stress, frustration, and confusion for foster parents, emotional duress for foster children due to canceled visits, uncertainty, and other things like that, disrupted placements, and then also delays in achieving permanency and also delays in receiving necessary services were all kind of consequences of the issue of lack of communication. In terms of placement disruption, about 45% of participants reported that they had asked for a foster child to be removed from their home. Some of those reasons included the behavior of the child, a lack of resources for the child or the foster parent or someone in their family, problems with DSS or their private agency, and other. I just want to note that those percentages do equal up to over 100% just because participants were able to select any that applied. So if it was multiple, they were able to select that. So that is why those numbers are not quite 100. And then in terms of other, so some of the responses that participants often cited were specific consequences of the child's behavior. So not just the behavior itself, but those consequences, such as a child being kicked out of daycare, which resulted in the resource parent no longer being able to provide care, or behavior posing safety concerns. Also noted was children making false allegations of abuse or neglect. And then also in other was when children needed a higher level of care than could be provided in the home. For foster parents who had requested that a child be removed, 84% reported that the agency was able to find a new placement for the child. And then we'll be switching gears again. So the next topic of findings is relationship with the birth family. So 68% of participants reported having contact with the foster child's birth family. The contact consisted of phone or text messages, email, supervising visits, seeing them at the child's appointments, and then also contact that was facilitated through the child's social worker. And they did report that contact was most often initiated by the child's social worker, but it had also been initiated by the foster parent themselves, the birth family, and even the foster child at times. And then again, just a direct quote from one of our participants that we felt really highlighted this. So they said, I have had good relationships with most of my foster kids' families. This occurs more when the social worker is more communicative and gives me the needed background to effectively navigate and foster a trusting relationship with the family. So just again, the importance of that communication with the worker in facilitating that relationship between the foster parent and the family. So some of the recommendations that foster parents made for building relationships with birth family included having consistent contact, providing them updates on the child, giving the parent pictures of the child, supervising visits, inviting parents to the child's activities and events, being empathetic, respectful, non-judgmental, open, and honest, communicating to the birth parents that we're all a part of the same team, and making efforts to work together with them. Despite those recommendations, participants did note some barriers or challenges to working with birth family. So participants noted the stigma that foster parents face, such as birth parents' belief that resource parents may want to take their children or molesters are the enemy. Those types of negative perceptions of foster parents can certainly be a barrier to building those relationships. Other barriers were working with birth parents who might struggle with mental health or substance use challenges, do not respect foster parents' boundaries, have different parenting beliefs, speak a different language, and those that are inconsistent in visits or in their efforts to achieve reunification. Participants also noted, again, the local department can be a barrier when they do not consent to the foster parents contacting birth parents. And so some solutions that were posed, foster parents stated that it would be easier to engage with the birth family if the local department facilitated this relationship. And some ideas that were provided were planning consistent interactions between the foster parent and the birth parent, mediating any conflict that may arise between the two, and then also just clarifying the role of the foster parent for the birth parents to help raise any of those negative perceptions that they may have of foster parents and help to kind of build that team. And then the next set of findings are going to be related to adoption. So 28% of foster parents reported having adopted a foster child. Some of the common barriers or challenges related to adoption were the long process, so court delays, delays in TPR, and lack of communication between the different agencies involved in the process. Need for more information and support post-adoption. So foster parents shared that they needed more information about getting new identification cards, accessing Medicaid, transferring important documents. One participant specifically shared that having an adoption handbook could be a really helpful tool in addressing some of that lack of information around those processes. And then finally, the adoption subsidy. Especially for children with disabilities, it was shared that the adoption subsidy is often not enough money to continue to support the child post-adoption. And also just the process of having to recertify for the adoption subsidy annually can be a barrier. One participant just said that it's really hard to remember to mail that form in every time to get that subsidy renewed. In terms of post-adoption services, so of those who had reported adopting, 68% felt that their adopted child is receiving necessary services. But when services were missing, they were most often mental health services, educational services, and respite. Only 23% of foster parents said that they would consider disrupting a finalized adoption if their child was not getting necessary services. And a majority of the respondents didn't feel that a lack of resources would keep them from considering adoption. Moving on to recruitment and retention of foster parents. So 82% of foster parents in the survey reported that they do plan on continuing with fostering. Some of the reasons that participants who did plan on quitting shared for kind of wanting to quit included their experience with the local department, the emotional toll of fostering, the increasing needs of children that are entering foster care, and then just a lack of space or no longer having the time to devote to fostering. And so I just want to note that I didn't put it on here, but I think 92% of our sample were currently licensed foster parents. So about 8% were those who had already quit fostering. And for those participants, their reasons for quitting kind of mirrored these individuals' reasons for wanting to quit. So it was kind of the same thing. And then the next 4 slides, I have just some direct quotes from participants about each of these reasons for wanting to quit, just to dig a little deeper into those. So this slide is a little overwhelming. It's a lot of words, but these are just a couple quotes about people's experience with the local department. So one participant shared, sometimes consider going with private agency as there seems to be more support and people seem more into making decisions truly in the best interest of the child. Another shared that we have considered quitting several times, but every time our love for the kid outweighs our exhaustion with the brokenness of the system. And then a third participant shared, DSS is so incredibly disorganized and dysfunctional. The workers seem to have little understanding of child development, seem unaware of how the school system operates, aren't knowledgeable about daycare and preschools. They can't answer basic questions about rules and procedures in DSS and for foster families, so we can't believe anything they say. Additionally, it's difficult to understand why DSS keeps kids in foster care so much longer than federal guidelines recommend. The pendulum has swung too far in favor of parental rights. Kids deserve permanency and shouldn't have to sit in care for years and years waiting to see what will happen. I feel terrible that I'm involved in a system that values the rights of adults over the rights of children. So those were just a couple quotes that participants had written in the survey about kind of that experience with the local department and why that has at least led them to consider quitting fostering. And then we have two quotes about the emotional toll of fostering. So one participant shared, "It is too much on me and my wife with all the appointments and then having to deal with behavior after meetings with the birth family. Every week we start from day one and have to work towards getting the kids settled into a routine again. It is emotionally and physically exhausting." And then a second participant shared, "The last two placements, who are older teens, have been stressful and unsatisfying. I may take a break when my current placement moves to a transitional program." So just kind of considering that emotional impact that fostering has on the foster parents, and how that also leads to feeling like they may want to quit fostering. I think this is pretty self-explanatory, but we did have two quotes to share about the increasing need. So one participant shared, "If I would, it would," meaning if I were to leave, "it would be because the kids today have gotten to be a real challenge to work with." And another one shared, "The requirements to foster is now a 24-hour job, and the children are coming with more severe, untreated mental health issues, making it more difficult to foster." And then the last is about those practical reasons. So one participant shared, "We are considering quitting because it's becoming too difficult to reconfigure our bedrooms to allow for another child. Bunk beds are forbidden, but are the best space option for putting a couple of children in each room. Another reason is that we already have 3 children, and keeping up with their schedules in addition to another child seems daunting right now." And then another participant said, "I have other biological children that require our attention, and fostering has proven to be challenging and too time restrictive on our ability to parent the other children. We underestimated how much effort daily would have to be put into rehabilitating a child with trauma and neglect. These kids are not your average kid, and it takes a lot of time and patience to work with them daily. It's a lot for those with other children to do for more than a short period of time." And then I'm going to stop again. Stephanie, I know we've had a couple other folks join if you want to just.
Yes, if you haven't already, and I think most have, please make sure to put your name and your county in the chat box so that we can award your training certificate. And there was a question asked. I do want you to know the recording of this will be available. We'll post it on our Facebook site. And when we send your certificate, I will try to remember to include a link for their recording as well. So thank you.
Thanks, Stephanie. So participants provided some support that could be used to help them continue fostering. So first was more consistent communication, being listened to and advocated for, receiving more assistance connecting to services, and also with providing transportation for the various appointments and visits and things that children have to go to, getting more information about children in their care, being treated as a member of the team, better funding, and access to respite and childcare. So those are a couple different things, but I think kind of the two main themes are really about communication and being valued as a member of the team, and then also just getting access to those services and supports that are really crucial to support not only the child, but the foster parent as well. Despite the challenges that participants shared, 80% said that they would recommend fostering to a friend. Those that would not recommend fostering gave a couple of reasons. So the need for reform of the foster care system, the need for financial, material, and emotional support for resource parents, better teaming between the local department and resource parents, and a greater focus on the needs of the children in care. So these are just a couple quotes that kind of highlighted some of those. So one participant said, "It's an all-consuming endeavor and an over full-time job to assume." One said, "Not being treated like babysitters by DSS." And then the third participant said, the children need to be put first and the process needs to be modeled after other states where the birth parents don't get so many chances before TPR and things don't get drawn out for years on end, only to have children go back to their birth parents after 4 or 5 years. And so we touched on kind of the importance of supports. The next several slides just go through a couple different supports more specifically. So starting with mental health services for foster children. Most foster parents felt that their foster children had adequate mental health support, but over half, around almost 60%, had to request mental health services for their child, and 42% had to wait an extended period for those services. Responses to how long they had to wait range from 11% who had never actually received the service that they requested to over a year of waiting. But the highest percentage, around 33%, had to wait 3 to 4 months before those services were started. And the most often cited services that were unavailable were therapy, psychiatry services, both inpatient and emergency psychiatry services, infants and toddlers or other developmental therapies, so OT, PT, speech, those types of things, and then also PRP or psychiatric rehabilitation program services. We also looked at mental health services for foster parents. So close to a quarter of foster parents reported that they or a non-foster member of their household needed mental health support. But of these individuals, slightly more than half, so around 52%, reported that those services had not been provided. In looking at both educational and medical services for foster children, a majority of foster parents reported that they have the support they need for their foster child's IEP or other school-related challenges, and 66% reported that they have been asked to be the educational or medical decision maker or surrogate for their foster child. In looking at respite, 207 foster parents responded to the question about respite, and 88% reported that they do have access to respite. 37% of them did report having to find their own respite, and for 18% of them, having to find their own respite was viewed as a problem. And so some barriers to accessing respite were being unaware of how to request respite or how it works, lack of respite providers available. That was specifically noted for older youth and sibling groups, and then not feeling comfortable using respite providers that they didn't know or trust. So in particular, resource parents shared concerns that the respite providers, if they weren't familiar with them, they might not understand the foster child's needs, they might not be trauma responsive, or they might not have an appropriate parenting style to care for the child. So those were some of the barriers or concerns about accessing respite. For transportation, 27% of participants reported having issues with transporting foster children to visits and appointments. The most commonly cited issues included being asked to transport at an inconvenient time, not having transportation resources available, the agency not providing assistance with transportation, getting last-minute transportation requests, transportation services dropping off late to visits, and then transportation services not being suitable for child's needs. So specifically, participants noted transportation services not bringing a car seat or other things necessary to transport the child. And then also participants cited that oftentimes the transportation services, the person who would be providing those services was changing frequently, and that made that trip stressful for the child because it was not someone that the child was familiar with. And then lastly, childcare. So although most foster parents, so close to 80%, reported that they could find childcare for their foster child, many cited challenges with childcare reimbursement. And so the issues that were identified were unclear or conflicting information about the reimbursement process. So foster parents reported that they felt like the information they received from the local department regarding the reimbursement process was unclear or conflictual. there was a lack of clarity over who was able to be reimbursed and what was eligible for reimbursement. So specifically, a few foster parents shared that they had been told that the resource parents themselves could not be reimbursed for childcare. Only the childcare provider could receive that reimbursement. And another participant shared confusion about whether they could be reimbursed for that initial registration payment that they made to the childcare. Participants also cited payment delays and missing payments. So payments were reported to occur anywhere from a few weeks to over a year after the payment was due. And on average, foster parents reported that it took around 2 to 5 months to be reimbursed for childcare. The delays, of course, caused foster parents to have to take on that financial burden of paying for childcare out of pocket. And it also caused a potential inability for the child to continue those childcare services. It also made it harder for foster parents to even find childcare providers to begin with. And we have a specific quote about that. So one participant shared, "I work full time, but managed to piece together leave and flex time to care for our foster baby for 5 months while we waited for the childcare center near us to open. We had found a wonderful home daycare option nearby where our foster baby, whose first family speaks Spanish, would have been cared for by Spanish speakers, but they understandably did not want to deal with all the payment issues with the county. So we had to wait for a much more expensive center to open where the company could manage the delayed payments." So that just kind of highlights that impact that those delayed payments can have, not only on the foster parents, but also just being able to find childcare for the children in their care. And then I am going to, I guess, pass it off to Paul for group discussion. I don't know if we want to stop the recording.
Can I say one thing? Before we go to any discussion, and I apologize, in the beginning, we never really got introductions. There was a lot of work and effort and time that got put into this, the survey and putting this, first Tuesday together. So I just want to take a moment for everyone to be able to introduce themselves. If you can go, Kim, if you can go back to the first slide.
I can.
So just to make it easier, I will go ahead and start with myself. I'm Stephanie Lang. I'm the current executive director of the MRPA. I was hired back in August. I am also a current active, I have openings as a foster parent. I'm an adoptive parent, a biological parent, step parent, and guardianship parent. Between all of those, I have 7 children. And I'm also the president of our local Calvert County Association. And I want to go ahead and introduce Andrea Widener, who is the current MRPA president. And then Andrea, when you're done introducing yourself, if you can kind of pass along to everyone that's kind of put their work into this.
Yeah, I'm Andrea Widener, and I was a foster parent in Montgomery County for 9 years. I'm not currently active, but and I've been working with MRPA for I think maybe 4 or 5 years now, trying to stay involved and help advocate for foster parents. And I worked on this survey. So maybe Paul, do you want to go next?
Certainly. Good evening, Paul Brusky, and I also with Ralph. I'm a member of MARFY, Maryland Association of Resources for Family Youth, and I've had the pleasure of working with this group. And foster parenting is just a passion of mine. Although I am not a foster parent, I don't think I could do foster parenting. I do have 3 grown boys. My oldest is not my biological son, and I have 3 grandchildren.
Ralph, you want to take it? Kind of give your introduction.
Yes. So Ralph Belk, Deputy Executive Director with the National Center for Children and Families. We're one of the providers that do family-based foster care, continuing with child welfare services, but also with Paul. I am part of MARFY, co-chair of MARFY, and with Paul, co-chairing our sub-work group that's really working on foster parent and foster parent supports. And so it's been a pleasure working with this group and working with our foster parents and getting feedback from the foster parent, foster resource parent community. So again, thank you. And I'll pass it over to Kim.
Thank you. Oh, were you going to say something, Stephanie?
I was going to say Hallie or Kim, either one of you can go.
Yep.
So my name is Kim Williams. I'm a senior research analyst with the University of Maryland School of Social Work. We do a lot of work with evaluating the child welfare system in Maryland. I'm also a PhD candidate at the University of Maryland School of Social Work, and my dissertation really focuses on therapeutic foster parents and their satisfaction, commitment, and retention. So it's an area, like Paul said, that I'm very passionate about. It's something that I'm really interested in pursuing for my career in general, is looking at how do we better support foster parents. My dissertation is therapeutic foster parents specifically, but really foster parents in general. I also am not a foster parent, but I did work in therapeutic foster care with Paul. He was my boss for a couple of years, and that really just, I just never realized how much that I could learn from foster parents. So it really got me excited about doing that work. And then I guess I'll pass it to Hallie.
Hello, I wasn't expecting to introduce myself. My name is Hallie. I am a master's student intern at Kennedy Care, learning from Paul and all of the wonderful foster parents we have in their therapeutic foster care program over there. So thanks for having me.